Hi, everybody. It's really wonderful to be back here. So usually at this conference, I've been speaking on nutrition and integrative care. And I've been working with so many post-surgical patients, and I decided that this is what I wanted to share with all of you. And as you know, those of you who heard me speak before, I do take an integrative approach in my practice. I am a Dr. Vada manual lymph drainage therapist. I've been treating patients for over 25 years. And I've been treating post-surgical for over 25 years as well. And now, of course, all the wonderful surgeries that are done for fat disorder patients. The right one, okay. I have nothing to disclose. And so what I wanted to talk about is having a plan. So you've decided to go in for surgery. You've selected your surgeon. You know what tools they're using, or maybe not. And so now you want to prepare and plan. And so this talk is just to help you to make things a little bit easier in the preparation and in the healing. So I really urge you to take at least 2 weeks off of work. If you go back after 5 days, you can do it, but you will be exhausted and you're wanting your body to heal. So that's my advice. Arrange for a family member or a friend to stay with you at least for the first 24 hours and possibly the next few nights. You want to rest and you want your body to heal. You're not going to feel like cooking after surgery, and you need to have healthy food. So I suggest that you do some meal preparation in advance. You can make large batches of soup, put that in your freezer, have protein shakes around, and meal replacements so that you can do that as you are healing. Many patients don't feel like eating for a few days after surgery, but you still need to have nutrition in your body and good protein. Have healthy snacks on hand, like hummus and healthy protein bars. Bone broth is really helpful for the gut, and the gut microbiome is really important. I gave a whole talk on that a few years ago. And you want foods high in fiber, and also you can have prune juice that you're preparing, because there can be some constipation after surgery. Prior to surgery, did I miss a slide? No, that's good. So prior to surgery, there's some things that you can start doing to help with the healing. Zinc encourages wound healing. Chelated magnesium and calcium tablets, these minerals will also help with the healing. 2 days before surgery, take some slow-release vitamin C complex. That will help you as well. Start taking probiotics to help with the gut microbiome. 70% of your immune system is in the gut. You want to take care of that gut. 2 days before surgery, start with a high-potency Arnica montana, which is a homeopathic, and you can take a 30C, and that's going to lessen the bruising, the swelling, and the pain as well. Do not smoke. I hope none of you are smoking anyway, but do not smoke for 2 weeks prior to surgery. It thins the blood. And then what also could increase the risk of bleeding, vitamin E, fish oil, and there are certain herbs, ashwagandha, which is an herb that helps with the adrenals and helps generally tonic the body. It can cause the risk, increase the risk of bleeding. You want to stop that, as well as garlic, ginkgo biloba, flaxseed oil, ginseng, and nattokinase. I'm going to talk about nattokinase a little bit earlier, but it can thin the blood, and so we don't want to take it before surgery. We want to take it after surgery. And some of the Chinese herbs can also increase the risk of bleeding. And then St. John's wort, which has a lot of side interactions, or valerian might interfere with the risks of anesthesia. So you should really look carefully at your herbs and supplements to stop taking them prior to surgery. A lot of times there's pain medications. The pain medications can cause constipation. So if you have on hand some Miralax, if you have all of this ready in advance, it's going to make your recovery so much easier, rather than suddenly, oh my God, I need this, and sending someone out to the store. Probiotic supplements will help with constipation and the gut health. You might get an itching, and you could use an oatmeal soap. Schedule your lymphatic massages after surgery. Do that ahead of time so that you get your appointments in. It speeds the healing and reduces edema, and I'm going to talk a lot more about that in a little bit. You want to relax and soothe. You might not be sleeping properly. You might be uncomfortable. You'll be in a little bit of pain. So getting some books on tape to help you, some healing music. I work in my practice. I put on beautiful music always as I'm working with my clients. You want to help lower your cortisol, and that also will help with the healing. I'm a clinical aromatherapist, so I work with lots of oils, but you can get a diffuser and get a blend with geranium, mandarin, and lavender to help you to sleep, diffuse that in the air, a nice serenity blend. Then to bring with to surgery, bring with comfy clothes that are easy to take on, put on, and easy to take off. Large sweats or a large dress. Have slip-on shoes. Tennis shoes are not that easy to put on and off after surgery. Have a sweater. You can be cold afterwards. Take a cheap shower curtain to put on top of your mattress, especially if you're staying in a hotel afterwards. And then you can also get the pads that will absorb because you will leak fluids. A disposable waterproof sheet as well. And then sometimes people get lightheaded afterwards, so I think it's a good idea to take an electrolyte powder straight after surgery. Coconut water is also really full of electrolytes. And then again, the arnica, to take it as soon after surgery as possible. Arnica is a homeopathic little tablet. You dissolve it under your tongue, and it should be taken 20 minutes away from food. I'm going to go into detail with all of this. We're going to talk about homeopathic, supplements, systemic enzymes, aromatherapy oils, stress, anxiety, and sleep, pain and healing. These are some of the things that we need to talk about, and then lymph massage, and then nutrition to speed the healing. So, first of all, for post-surgical healing is this Arnica montana. The cream or a gel applied to the area will help with the bruising and with the pain. Systemic enzymes will break down the fibrotic tissue and aid the reduction of swelling, bruising, inflammation, and pain. And I'll go into details with that, but systemic enzymes are proteolytic enzymes that dissolve fibrinogen and scar tissue. Vitamin C is fantastic for the healing. Bioflavonoids are wonderful, and bioflavonoids are part of the vitamin C. It's a full spectrum vitamin C. Aromatherapy oils that speed the healing post-surgery. Helichrysum, moringa oil, those are certain oils that can help with the healing and also with the bruising. And then stool softeners and probiotic supplements can help with constipation. You can also take a fiber supplement every morning and evening after surgery. This is flaxseed, chia seeds, and you could put them on soups or salads or in your smoothies. They're good. Some of these things are really good for you to do anyway, because post-surgery you want to be even healthier than you were before to maintain all the results that you've had. So it's very important. You want to promote healing while simultaneously reducing the formation of excess scar tissue or adhesion, and also reducing the swelling. When you reduce swelling and inflammation, you reduce pain. We've been hearing a lot of that today. It's expected that you're going to get swelling and bruising after surgery. Could be an itching sensation, and or there could be numbness. It improves as the time goes by. So the first 4 days, you can take the Arnica montana to every 3 hours for the first 4 days. The cream onto the areas where you're in pain, always avoiding the open areas. And what Arnica does, it helps to disperse the blood at the surface level of the skin, and that helps the bruising to go away with time. I make up a trauma oil with calendula, Arnica, St. John's wort. St. John's wort really helps with nerve pain, aloe vera, and essential oils of helichrysum and lavender. If anyone wants to know more about aromatherapy, you can come and see me. I'd be happy to help you. Manual lymph drainage is very, very important for your post-surgical care. It enhances the healing, it decongests the tissues, it helps to reduce bruising and pain. As we do the manual lymph drainage, it actually blocks the nociceptors. Someone earlier was talking about the pain and the nociceptors, but as we do a pressure and release with our manual lymph drainage, we're actually stimulating the mechanoreceptors in the skin to block the nociceptors, so it really helps with pain. And it's suggested 2 to 3 times a week for 3 to 4 weeks, definitely for the first 2 weeks, and then assessing, depending on your surgery, 2 or 3 times the following week. and to continue for several weeks post-surgically. Every case is different, of course. We want to increase oxygenation, hydration, and cellular metabolism and the health of the tissue. And we can do this with manual lymph drainage, and it feels wonderful. My patients just say, oh my God, thank goodness. What do people do when they go through the surgery without having the lymph drainage afterwards? So we want to help speed the healing process and enhance healing. Lymph drainage will detoxify and remove metabolic wastes, alleviating pain. I explained that to you. Relaxing the nervous system. It has a sympathetic effect, which brings down sympathetic activity and brings up parasympathetic. Increases the healing time from injuries and from surgery. Reduces swelling and edema. Lowers blood pressure. I always tell my patients to be really careful getting up if they have low blood pressure. And it strengthens immunity, and it will also help to reduce the risk of fibrosis and scar tissue. So you've got this fabulous surgeon, you've done fabulous work, now you want to help with the healing and do it in the best way possible. When you do have lymphatic massage, there'll be a reduced risk of fibrosis and scar tissue forming, and an increase in waste disposal by transporting the proteins out of the area. Inflammatory wastes will be removed. And this facilitates the healing process after the surgery. So now we really have to talk a bit about nutrition. So you can, if you eat plenty of fiber to try and avoid post-surgical constipation, fresh fruits and vegetables, oatmeal, legumes, and of course, as you should always be doing this anyway, avoiding all of this, but definitely after surgery, avoid processed foods, cheese and dairy products, red meat, and sweets and candy. Fats, it's really important to have that. Olive oil, avocados, coconut oil, nuts and seeds are really important to help with the healing. And then having the right type of carbs, such as fruits and veggies and the beans and lentils and all the legumes. If you are constipated, magnesium can also help with the constipation. And then green juices, smoothies and protein powder, really wonderful to have green leafy vegetables, kale and chard. And again, this is something to sustain after surgery to help yourself to be the healthiest that you can be. You can get vitamin A from oranges and dark green veggies, potatoes, kale, and spinach. Vitamin C from citrus, tomatoes, will help with wound healing. Vitamin D, which lippy ladies and Durkheim's ladies should be taking lots of vitamin D because we don't absorb the vitamin D as well. And vitamin E from vegetable oils, nuts, beef liver, and eggs to protect the body against the free radicals. And then vitamin K, which is needed for clotting. The green leafy vegetables are really high in that. Foods high in bioflavonoids. You can take bioflavonoid supplements, which are great for the connective tissue, great antioxidants, but then you can take foods that are high in these bioflavonoids. So that will neutralize the free radicals, prevent inflammation, and then when we look in nature, the different colors have different chemical components in, and the foods that are red, blue, and purple are high in anthocyanins and also flavonoids, which are really antioxidant. Citrus fruits, broccoli, kale, and parsley. And then if you add color, you add a rainbow diet to your diet, and you will be getting the nutrients from everything from the ground. You're getting all the minerals that you need. Post-surgically, I really like curcumin, which is an extract of turmeric, vitamin C, bioflavonoids, zinc, vitamin E, which is, I told you, you don't take that pre-surgery, and then a vitamin B complex to help with inflammation and the nerve endings. We spoke about the probiotics, chelated calcium and magnesium, and proteolytic enzyme formula, which I'm going to talk about now. So systemic proteolytic enzymes will dissolve and digest non-living tissue. They break down scar tissue, excess fibrogen and adhesions. They help with the repair and recovery or injury. And a good proteolytic enzyme will have bromelain, papain, protease, serrapeptase, nattokinase, and catalase enzymes in them. Those are taken outside of food. They must be taken 30 to 45 minutes away from food otherwise it'll digest your food, and we're wanting it to work systemically on the tissue and on stopping any scar tissue from forming. They also help with inflammation. And then systemic enzymes, there's another one called serrapeptase. Sometimes you can get that on its own. The physicians in Europe and Asia use this as an alternative to aspirin, ibuprofen, and other NSAIDs. And it can dissolve fibrous and or scar tissue. It also helps reduction of pain. It showed better anti-inflammatory activity on acute inflammation than trypsin, chymotrypsin, and aspirin. And the dosage is 30 milligrams for 2 days. Sometimes when you are taking systemic enzymes, you might get a little bit of pain in your tummy. You might feel a little nauseous, as there's a die-off of everything that can happen. Then you just cut back on the dose a little bit and then increase. Nattokinase is another proteolytic and fibrolytic enzyme that supports healthy circulation by breaking down the fibrin. It's from fermented soybean, and it also supports healthy circulation, great for lipomas, and the suggested dosage is 2,000 FU per day. Garments, I know you had a whole talk on garments, but your surgeon will give you the correct garments that you need. You're going to have something for your arms. You're going to have a high-waisted garment for the legs with an open crotch. And get a little silo cup to help you go to the bathroom with that open crotch, by the way. That helps a little bit. And then you need to wear your garments 24/7 and listen to what your physician has told you. Those garments are really, really important to wear afterwards. So just a summary checklist of some of the things we said: comfy shoes, sweater, slip-on shoes, plastic shower curtain, pad, electrolyte powder, coconut juice, bone broth, homeopathic care, supplements, and proteolytic enzymes, aromatherapy oils for healing, anxiety, and sleep. Schedule your lymph drainage treatments, have your meal preparation, your stool softener and your probiotics, and your proteolytic enzymes. And I wish you safe and successful surgeries. And I love working on all the patients, and we've got fabulous surgeons here. And the most important thing is to love yourself. Love yourself for who you are. You're going to look more beautiful, you're going to feel more beautiful, but still love yourself. So thank you so much.